Deep in the complicated tunnels of the military health system, you'll find a job known as behavioral health technicians. The function dates back to World War II, and practitioners have a lot of influence over the mental health services service members receive. So much influence that the military medical leaders enlisted the RAND Corporation to study behavioral health technicians. Here with what they found, senior behavioral scientist Dr. Kimberly Hepner. Dr. Hepner, good to have you on.
Good to be here, Tom. Thank you.
What prompted the look at this particular job function, and maybe tell us what it exactly does?
So the Department of Defense asked RAND to assess the roles that behavioral health technicians currently fulfill in the military health system and really how to help to optimize their role. How can they better support the behavioral health of the force? Behavioral health technicians, there are about 2,300 of them across the service branches. They're enlisted service members who work alongside and support the licensed mental health providers in the military health system. So they might be called mental health technicians, behavioral health specialists, psych techs. And this is a really important role in providing behavioral health care. This role is sometimes called a care extender because they can extend the reach of mental health care, helping to ensure that service members have the support they need. They can do a variety of things, a variety of clinical responsibilities, including conducting screenings, delivering interventions, case management, and outreach work. All to ensure that service members have access to the care that they need.
And is there any analog function in the private sector?
Yes, there is. So psych tech or psychiatric technician or psychology technician is actually an analogous role in the civilian world. But the role of the behavioral health technician in the military is actually unique in many ways. They receive quite a lot of content training in a very brief period of time. So we found that the curriculum they receive covers a wide range of topics, aiming to prepare them to be in a variety of settings in garrison, so in military treatment facilities, but also in deployed and operational settings, more austere environments. And this training is covered in about 17 weeks, and they can be asked to do a wide variety of clinical responsibilities. And so part of what was driving this study is wanting to ensure that behavioral health technicians have not only the training that they need to perform in these different environments, but also the on-the-job, ongoing training and professional development, so that when they're tasked to do this wide variety of responsibilities, that they're well prepared to do so. Our work actually found that their clinical responsibilities can vary widely. And so one of the things that we recommended was to ensure that there is more guidance on the kinds of ongoing training and professional development that behavioral health technicians can receive to ensure that they are ready not only in those military treatment facility kind of in garrison environments, but the more deployed or operational settings where there just may be fewer behavioral health resources, and the force may really need to rely on the expertise of that behavioral health technician.
And it looks like one of the findings was there could be more consistency from armed service to armed service with respect to the training and deployment and the way these people are used.
That's right. So we found some variability in both the training and the on-the-job training requirements across the service branches. So, for example, in Army and Air Force, the behavioral health technicians enter the training directly from basic training, and whereas the Navy behavioral health technicians have corpsman training before they enter their behavioral health technician training. So they actually receive even a different number of weeks of training. There is some core training that they receive. There's about 9 weeks that is core and common across behavioral health technicians across the service branches. But then there's variability from there. There's variability in the type and length of the practicum training that they get, and then different expectations for on-the-job training. So one of the recommendations that we made was to ensure that there is more consistency across not just training but on-the-job requirements, and providing guidance to the licensed mental health providers who work with the behavioral health technicians on what are the expectations for helping to ensure that behavioral health technicians are well trained and can have that ongoing professional development in order to fulfill their roles.
We're speaking with Dr. Kimberly Hepner. She's Senior Behavioral Scientist at the RAND Corporation. And is there the potential that if you have a poorly trained or somehow misused or misdeployed type of behavioral health technician, that you could do some more psychological damage to the patient, because that would be the patient's first contact with the whole mental health apparatus?
Sure. Just like any mental health practitioner, behavioral health technicians do deal with sensitive mental health issues. So we want to ensure that they're well trained because they conduct screening roles, for example. They may be some of the first behavioral health practitioners that service members come in contact with. So we want to make sure that that is a positive experience and that behavioral health technicians are well trained, just like the rest of the behavioral health workforce in the military.
And we're sort of using the words behavioral health and mental health interchangeably. Are they in fact interchangeable? And if not, what's the difference? What are the nuances there?
So we often use the term behavioral health to make sure that we're including both mental health and substance use care. So that would include if there are concerns about unhealthy alcohol use. Behavioral health technicians, for example, could lead groups or educational groups or outreach on identifying concerning alcohol use and how to reduce that alcohol use. So behavioral health is a bit of a broader term to make sure that we're including any alcohol or drug use issues.
Sure. And you said there's about 2,300 of these people in the military health system. Does the Veterans Affairs apparatus have a similar type of job? And is there consistency between the type of treatment that someone would get while still deployed or still in uniform versus what happens in VA?
Yes, so there is an analogous role in the VA. They're typically called psych techs or psychiatric technicians, and there is a similar amount of training. They might perform quite different roles in some ways because the military behavioral health technicians really need to perform often in austere environments where there may be not a full suite of behavioral health technicians available downrange, for example. Whereas in the VA, a psych tech will be practicing as part of a more complete team of behavioral health practitioners. That situation is more like what we would see in garrison in a military treatment facility environment, more of a full team of mental health providers. And that's why the military behavioral health technician role is really so important, so that they are prepared not just to perform the roles that they perform in military treatment facilities, but as they are deployed or in operational settings where the unit may rely heavily on them and their expertise to meet mental health needs at that time.
So it sounds like in the forward deployed or austere environments, that technician is in fact the mental health care system until such time as someone can get back to garrison or base.
Sure. There may also be a primary care physician. There may be another, there may be another mental health practitioner there with them. But certainly the demands on ensuring the expertise of that behavioral health technician is very important when they are in these deployed or operational settings. They play a very important role. And so ensuring not just that they're getting adequate training, but that they're continuing to use those skills when they are in garrison or not deployed, continuing to use those skills so that when they are in deployed environments, that they're ready to use those skills and feel comfortable being one of the key behavioral health resources for service members.
Any other key recommendations that you want to get out there?
So we encourage the Department of Defense to tailor the curriculum to focus on the conditions and the clinical skills most relevant to the populations that behavioral health technicians will actually see in the field. As I mentioned, the training is quite brief, so about 14 to 17 weeks, depending on the service branch. So that's a lot to cover to prepare behavioral health technicians to be ready to see service members when they are assigned. We also recommended more specific guidance for on-the-job training and guidance to mental health providers on how best to work with behavioral health technicians.
Dr. Kimberly Hepner is Senior Behavioral Scientist at the RAND Corporation. Thanks so much for joining me.
Thank you.
We'll post this interview along with a link to her report at federalnewsnetwork.com/Federal Drive. Subscribe to the Federal Drive at Apple Podcasts or Podcast One.